Just like any other child, 9-year-old Juliet Nekesa loves to play a lot. The company of other kids give her the will and motivation she needs to carry on with her life. She had a normal childhood since birth. Her health complications, however, did not begin until January 2017.
I started noticing some changes January last year. That is when she started complaining of headaches and then sore throats, earaches, and they were frequent.
When she was taken to hospital, she was given antibiotics and some painkillers. In July 2017, the symptoms got worse.
She had imbalance. She was shaking when she was writing. The handwriting gone. It was gone kabisa. And then when she was walking, she was staggering. And now the headaches were severe, very severe.
That is when Juliet's mom, Scholastica Muturi, realized that she needed to take her to hospital for thorough checkup.
CT scan showed that she was having a tumor, which is called MEDULLABLASTOma. So, and we were told that we have to act very fast because according to the symptoms, it was getting critical.
At the beginning, she was in denial.
Why my child? Why is this happening to me?
Juliet went through surgery. The tumor was removed and it was revealed that the cancer was at stage 4.
Then we were referred to Texas. That is now here. So we came here and now we started our treatment with the radio for 30 sessions and the chemotherapy was for 6 sessions.
The treatment affected her studies.
Tangu nikuwe mgonjwa, sikuwa naweza kwenda shule tangu 3.
But what really is medulloblastoma?
Medulloblastoma is a form of childhood brain tumors. They are very common and it occurs in the part of the brain which is called the posterior fossa.
Dr. Nyongesa gives an explanation of the major signs and symptoms of this kind of brain tumor in children.
Most of the time, because this is a space-occupying lesion, it occupies part of the brain, so patients may present with headache, dizziness, they may present with weakness in terms of movement, the body weakness, hands and leg weakness, and because of the increased pressure in the brain, it can present like vomiting.
The main treatment includes surgery, chemotherapy, and radiation therapy. Any cancer at stage 4, just like Juliet's, is always perceived to be at a critical stage.
Fortunately, medulloblastoma are quite sensitive to treatment, and after good surgery, they can be treated and children can recover. Yeah, but the chances of cure are less and less as the stage advances.
Just like any other cancer treatment, the treatment for medulloblastoma is expensive.
I mean, surgery alone can take up to even 200 to 300,000. Then when you put radiotherapy maybe and chemo, another 150,000. And then on follow-up, it's a long-term treatment. So patients spend not less than 500,000 to 1 million Kenya shillings.
In Kenya, there has always been a challenge of misdiagnosis that most of the time leads to the cancers being detected in the late stages.
Cancer symptoms, signs and symptoms mimic other diseases, so they can be quite misleading even to the doctor, even an experienced doctor, and it needs a very high index of suspicion. What I would say is, even if your child or person has these common symptoms that mimic infection and they don't go away for like over 2 weeks with simple treatment, one needs to take another step and probably get a scan done or more tests done to exclude cancer.
Though medulloblastoma is rare, it's the most common cancerous brain tumor in children. Globally, childhood cancer incidence is increasing with 300,000 new cases diagnosed each year. 215,000 between the age of 0 to 14 years and 85,000 between the age of 15 to 19 years. Many more cases remain uncounted and unreported due to lack of childhood cancer registries. Nuru AbdulAziz, Ebro TV.